What's up, guys? I'm coming at you from Shenzhen as usual, but for a little bit of an unusual video. As some of you know, I have usually a strong opinion on certain subjects, or I have a certain position, but I definitely want to put that aside for this video. What I have for you today is an interview with a doctor from Wuhan. Well, he's not from Wuhan, he's from somewhere else, but he was part of the second wave of doctors that were sent over there. And considering the situation that's being faced around the world now, where a lot of people are worried about their own hospital systems eventually or very soon becoming overloaded, we're going to hear from somebody who in Wuhan, of course, was dealing with that very situation where they were very overloaded at one point. And I want to talk to him a little bit about what they did on a day-to-day basis, what their processes were like, how they kept their spirits up. Perhaps he can offer some tips and tricks for medical professionals overseas. And perhaps for the ordinary person overseas, they can look at this as a light at the end of the tunnel, considering how many cases we had here in China and how spectacular of a job they did bringing these numbers down. Now, one way or another, I hope you do find some value in this video. You'll have to bear with the quality. I am going to be using video conferencing software, and he's in Wuhan. I will use the local audio from my side. The audio on his side might be a little bit choppy, so bear with me and let's dig right in. So hi, Dr. Robert. Thank you so much for joining me. And I just wanted to kind of introduce what we're doing and to my audience and to you why I'm so excited about this. As you know, there's a lot of kind of finger pointing going around the world, and the fact of the matter is, you're a doctor who has experience there in Wuhan, and when it comes down to the end of the day, there's a lot of countries that are about to face really hard times ahead, and you guys have experience with that. And when that time comes, they're not going to care about finger pointing anymore. And you guys have so much valuable experience, and just to find out a little bit more about just your experience on the ground. And of course, what you're going to be saying is completely personal opinion. It's not representative of any organization or anything. And so I really appreciate it. So thank you very much for joining today.
You're welcome.
Yeah,
very happy to be here.
Thank you so much. It's you guys are heroes in China, and I'm so glad that you're being celebrated as heroes. I'm so happy to be able to talk to you. It's really an honor. And I guess we should mention how we know each other. So we have a mutual friend, a Canadian friend, Kirk. And
Yes.
and then furthermore, I was so honored to find out that you actually follow my channel and you saw some of my videos before, which was just I was so happy to hear that. So obviously, you guys must be quite. Are things winding down now, and you're feeling a little bit more relaxed? You're feeling like you've really accomplished something big here, and people are starting to be able to breathe more easily now.
Yes, I do. The new cases that kind of has already been 0 for 3 days here. Currently we have some severe cases who has been ill, who has been in our hospital for like 2-3 weeks, and those are very elderly patients who's in their 90s, 80s, and they have a lot of complications and underlying diseases like background diseases. So we are dealing with that. Those old patients, they don't have any relatives or family members around them, so that need a lot of time, and because they're very old, so they recover very slow. So that's kind of our current job. Yes.
So do you have some other elderly patients in the past that did recover, and you do find that they really take a lot longer for their system to fight this, for their body to fight this?
Of course. In my department, I think at least 90% of them will eventually recover, and it takes a long time, and it takes very intensive care, both medication and the nurses care. Yes.
So although there's a sigh of relief, although there's some, there seems like there's a light at the end of the tunnel, obviously there are some patients that you're still very worried about and you still have to take care of. And the fight really isn't over in that sense.
Yes, exactly.
I'm wondering, so obviously when the numbers kept going up and up and up, and we saw that big increase in numbers, especially when they changed the testing metrics and everything like that, and they started testing more people, was there ever a point where you guys, or some of you personally, you almost wondered if there was any hope? Like, did you ever think, oh my God, maybe we're not going to be able to beat this? Did you ever feel like that, where you were kind of losing hope sometimes?
Yes, I did. Yes, I did. Actually, funny you mentioned that. Actually, we came here at February 13th, right? So before that, the rumors and this false information or kind of exaggerated information are circulating in the website. Actually, that's why the Western media is saying that government is censoring the WeChat. It's actually not censoring, because there's so many false information. It's saying that people are dying in the street and collapsing in the street, and there's not even enough how do you say corpse bag to contain all the dead people. So like a few days before we left our hometown to come to here, I kind of got very frustrated or worried about the situation. So I was talking to my wife, still, I mean, especially when you have two kids that are in their the cutest age around you, and you kind of get very worried about the situation. So I was talking to my wife. She said that worst case happen, you just stick to the rules that your rescue team, the medical team has set up for the team members. You just stick to every rules there, and you'll be fine. So yeah, I was kind of worried, but as long as I came here, that worry is gone, because I saw the situation is everything is under control, and everybody's working, and nobody's panicking, especially all the supporting teams and doctors and the government officials, the drivers, and the personnel in the hotel, personnel in hospital. Everybody is working, and they're not panicking. So I kind of relieved. Yes.
Yeah, I guess so. I mean, even I mean, I think for ordinary people also. I mean, I can only imagine for you, but here I've been staying in Shenzhen for the whole time, and we have 4 young kids, and my father-in-law has pre-existing lung conditions, so we were really quite worried. And it's the same thing, we obviously, I listen to Western media also, and I was continually being told the numbers are fake. And my sister-in-law, actually, she works in one of the provinces on the front line, taking care of the quarantined people, like going around, checking on them every day, making sure they have what they have. And I even reached out to her a number of times, and I asked her, I said, what do you think about these numbers? I said, do you think they're real? And she says, yeah, she thinks they're real. They're not lying. But that was the time she says she feels like a lot of the suspected cases probably will turn into actual cases. And that, I think, turned out to be true, because that was before that we saw the big jump when they changed the metrics of how they were testing people.
Yes.
But
yes.
I mean, I can only imagine for you guys on the front line. I mean, so was there anything that was done from the hospital or the government or amongst the staff to keep your spirits high? Like, how did you stay positive? Were there any specific things you did, or you just had to really figure it out and keep yourself encouraged?
Nothing specific, but right, even before we left my hometown, actually we have enough information, well everybody's well informed, because in the TV channel, the government has already provided everything in detail, all the knowledge, all the tips, all the information about the symptoms, about the syndromes, the clinical presentations, everything is there. So you just watch the TV channel and watch the guidelines, and everything is there. Especially after you came here, you got everything you need, right?
Right.
And after we came here, it's like so many medical teams has already been here. It's like we have like at least 50 to 100 medical teams here. Yeah. The numbers varies from like a couple dozen to like 200 for each medical team. So we have enough personnel, and we have enough resources. Then you don't have anything to worry about it. It's just you have to arrange your working shift very very precisely. You have to arrange the shift nicely, so that you don't use up your energy. And then if you have enough energy, then you will not panic to
Yeah.
worry anything.
So now I'm wondering though, because this is such a new thing, and obviously the government has these guidelines that came out, and they say, okay, this is what you should do. How is the communication process? Because I would imagine on the ground as doctors, sometimes you would discover new things. You would say, oh, you know what, this is actually working well this way, or maybe we should try this, or you know what, I noticed this. Was there a system in place where when you discovered things, the information could pass through and you could work together to find the best solution as you went along? Or was it a little bit more, there was certain people responsible for that and you just have to kind of follow that along? Or was there a system for you to provide feedback?
There's I'll tell you how it works. So we work in a hospital. For the junior doctors, like me, so in their 30s or in their 40s, these junior doctors, we work in a red zone constantly. So you work bedside, you go in there, you check the symptoms, you do the body exam, and you read all the blood test results, all the nucleic acid test results, and CT scan result, and you do the analysis. And every day we have a meeting with the senior doctors. The senior doctors, they spend some of their time in the red zone with the patient, but they spend some of their time connecting all the critical information, valuable information, and they have their meeting on daily basis, or the video meeting collectively. All the senior doctors from one hospital, they will do video meeting every day. So they will share the valuable discoveries they find on this situation, on this bedside results. And they will do the analysis. If they find anything valuable, they will share it with all the hospital in Wuhan. So they have another video meeting like every 2-3 days. So all this information from the bedside goes to collectively database, the whole citywide database, like every 2-3 days. So once they find something, some trend or some discovery that applies to most of the patients, they will again report to the nation's health office, and they will do, deep analysis, or they do the new drug discovery, things like that.
So did you see that from, for example, your first day that you were starting in Wuhan, when you arrived in Wuhan from your hometown, to the most recent days? Did you see the procedures evolve during that time? Like what you did 1 month later was different than what you did on the first day because of that system? Like you had certain things that were changing?
Yeah, of course. So the funny thing is that this is a brand new virus, and we don't have any known medicine that can treat this, can cure this. So every medication you use is actually a clinical trial, but it doesn't. You just don't have to sign the informed consent for every medication, because some of the traditional or conventional antiviral medication, you can use it, but it's not originally designed to treat this, COVID-19 virus. So we kind of have to try a lot of medications, and we collect the result of the blood test, the CT scan pictures, and the symptoms relief. We collect every information. So we share this data that to the database that we built nationwide, and the senior doctors, they do the meeting. So they will analyze it. So then they will come up with a primary conclusion. It's not a final conclusion. Primary conclusion. They will say that this kind of drug have the trend of infection. Have some trend of infection. So we will keep on do more formal clinical trials. So we do the informed consent. We do the controlled study. So yeah, things works like that.
Yeah, this must be such valuable information for you guys to go through this. And I mean, the world, again, a lot of people are focusing on finger pointing right now. And I did a video on that recently where I talked about, with all this finger pointing, with all this blaming, if people want to blame China, fine. Okay, if you want to do that, okay, fine. But let's get to the point here. There's very valuable information that could be pulled from China. And I don't know if you saw, I didn't read it myself, but I know that Jack Ma Yun, he released a report from one of the hospitals which detailed all of the best practices and all of this stuff. I mean, I really hope people overseas are going to start paying attention to this. But before I leave that topic, actually, I have a question. It comes from actually one of my friends who works in the Hong Kong hospital system. And she asked me to ask you, when you were trying all these different things, was traditional Chinese medicine any part of that? Was anything tried with traditional Chinese medicine, or it was mostly modern kind of Western medicine?
Yeah, traditional Chinese medicine is, I think, is a big part of it, because, as I said, there's no known medicine that is, has clear effect on this brand new coronavirus. So we have to try a lot of medication. The Chinese medicine is a big part. So first thing is that we have a traditional Chinese medicine elite group, nationwide elite group. So they are very, very experienced. They are very, well trained. So they come together. They check all the patient's clinical symptoms and the blood results. And sorry, I got a phone call cut out. Okay. So I'll repeat it. I'll repeat what I said.
Sure.
Yeah. So we have, like, the Chinese traditional medicine is a big part of our daily practice, of our daily observation. We have an elite traditional Chinese drugs team, nationwide team. So they collect the data and they research the symptoms, and they come up with a plan. They come up with a recipe, and the recipe is nationwide. Is the same nationwide. So we have number 1 recipe, number 2 recipe, and number 3 recipe, and it keeps going. Like now we're having number 6 recipe.
Right.
So a different type of recipe is for a special group of clinical symptoms. So you will research. So first, when your patient come, you will research his or her clinical symptoms, and then you apply a certain type of recipe to that person, and the drug has already been prepared, make into a soup-like bags. You just give the bag to the patient, they will drink it, and then you just you just keep the log of how the patient recover, how he or she react to this recipe. Put it into the database.
Okay. All right. So, and I'm not going to get into too much details about exactly what you used, because I'm not qualified to do that, and there's probably implications about telling people kind of potentially the wrong thing or the right thing. But what I do want to note on that, which was interesting to me. So it sounds like there wasn't necessarily a one size fits all solution. It really depended on the person, on the circumstances, and in some cases you had a Western medicine that might work better, sometimes Chinese medicine. It really wasn't a one solution for everybody, it sounds like.
Yes, exactly.
Okay, interesting. All right, I want to get more towards the kind of support side of things and how you guys dealt with things on a daily basis, which might be relevant for doctors and nurses who are preparing to fight this overseas, or the hospitals wondering how they can what they can do to support their staff better. So from a day-to-day basis, as I understood from one of the other interviews, you had your meals delivered to you every day, so you don't have to go out and try to figure out your meals. They were delivered to you. How did that work? And did you get to eat 3 meals a day with how busy you were?
Of course. Actually, we eat like whatever. How you say? You can eat 4 meals, 6 meals, 7 meals a day. So
whatever you
it's
need.
Kind of buffet. It's kind of buffet. So it works like this. You have a box, this big plastic box that's sitting in front of your door. So every day, before your meal time, the supporting team, they will deliver the box of this big box. It contains all the food, rice, noodles, and breads, and Chinese bread, Chinese buns, or dumplings, or meat and vegetable, everything in it, and soup and vegetable and drinks and they put the box into plastic bags. They will put in the box outside of your door. So when you get out from work, you will find the food is already there, and it's a temperature. It's a foam box which can keep the temperature for a long
insulated.
Time. Right?
Yeah. Okay.
Yeah. Stuff like so. You will find your food there, and you have different types of flavor according to your background, according to which province you're from. Because
Oh,
in China, yeah, northern part of China, people like to eat in noodles and mantou and buns and dumplings, and they don't eat spicy food, so they will prepare in that kind of flavor. And the southern part, or in Sichuan or Chongqing, people like to spicy food. They will also prepare spicy food for you. You have to leave a note in the box. So for the next meal you want, if you want spicy, you keep a note. You put in the box. So the person come here and they pick up the notes. They will know. Okay, next time you want spicy food, they will give you spicy food. Or you can, even if you want to pick some snacks, or you want any beverage, they will give you. Leave in the box. So yeah, it's
that's
very
so
very
nice.
convenient.
Yeah, that's so
Yeah.
nice to have that kind of support. Yeah. Yeah.
Also, they have
And
it's kind of buffet station in the hall. So in the hall, they have a buffet station. They put all the snacks and all the drinks in there. So after you come back, if you want some fruits, and you go there, just pick up whatever you want. It's very very detailed service you have.
yeah, that's really great. That's really great to show how much they cared about making sure you were accommodated. Now, was there
Yeah.
anything, in terms of the mental health side? I mean, did you have meetings where they tried to encourage you and kind of, or did you sometimes have to rely on your colleagues? Did your colleagues sometimes have to rely on you for emotional support? What was the emotional support piece like? Or was everybody just kind of staying strong themselves? Or did you have people to talk to and just was there anything in that sense, or you just had to there was no time for that anyways, and you just had to do what you had to do?
I'll tell you that we do have a kind of analyzed kind of how do you say it in English?
A therapist,
Strength.
therapist.
Therapist. You have a therapist deployed to every hospital. Actually, a therapist team, like a couple of people, like 5-6 people, doctors. They are therapists, so they will provide all the service, all the kind of treatment to doctors or nurses who needs them, and also they will do tour. So every day, different therapists, they will go. Okay, so it's like today, this therapist, they will go to the second floor. They will do all the questionnaire, ask the doctors and nurses how do you feel, and do you have anything that you want to talk to us, and they will give you a questionnaire you can put down, and they have a lot of questions you can write it down. So they will do mental analyze on the overall team, right? But strangely, that it feels like nobody needed. Everybody's they're working pretty normal. Because I don't know, maybe I guess me feel that Chinese, we don't need that much mental support.
Yeah.
Kind of,
But it's good. It's good that they put it there just in case.
Personally, I don't need that, and I don't find anyone.
I mean, we obviously, we obviously have to be careful with the videos we see online, but there were some videos showing some doctors, kind of breaking down or like yelling or really upset about something. And I think when you really think about it, we're all human, and I think that is possible. So even though if you and the people around you really handled it well, I think it's so good that, the hospitals arranged this for you to just make sure, and show you that kind of support. I mean, at the end of the day, you had some really good success rates with recoveries and stuff like that, but you are dealing with, obviously, of course, some patients passed away. That's probably difficult to deal with, and long hours, I would guess. What was, like, for example, your longest hours you had to do in one day?
Actually, so our working hours is the same as you work in the Western world. It's like from 8 o'clock to a.m. to 6 p.m. So 8 a.m. to 6 p.m. That's how the hour you work. But in the hospital, you work sometime in a red zone. That's the patient state. That's the patient sector, patient section, right? So that's the red zone. And sometimes you work in the green zone. That's where the doctors writing the paperwork, doing the computer work, and doing the meeting, and doing the analysis, and also the rest and the lunch room. That's the green area, green zone. So for the red zone, I think the maximum time is 6 hours. Currently,
Okay.
that's what applies to us. We have, because your N95 mask only sustain 6 hours. So after 6 hours, the function kind of decrease. You have more risk to get contaminated. Through this the mask. So that's 6 hours is the maximum. But normally, for the doctors, you only have to get in there 3-4 hours. Sometimes if you have to do the bedside some work, it's like endotracheal intubation or ventilator support, or sometimes if you want to do the deep venous puncture to do the catheter placement, that takes a longer time. So probably
Hmm.
you need like 6 hours, something like that. But normally you spend like 3 hours, 4 hours in the red zone. Then you get out. Then you write down. And you do the paperwork. You do the computer work, and you do meeting, and you do the communicating between different departments. So you arrange the CT scan, arrange the blood test, all the swab, sample swab collection. Yeah, and for the
Right.
nurses, it's kind of more difficult because the nurses, they are doing all the labor work because they're
Hmm.
gonna take care of everything for the patient. Because you have to put in mind that this is a contagious disease, and the patient comes alone. They don't have any family members with them. So normally, in normal time in China, in hospital, a patient come with at least one or two of the family member to take care of him in hospital. They provide all the meals, drinks, and do they wash your face, and do they. But this is contagious disease. Nobody, no family members in hospital, and especially when you're treating the elderly patients who cannot take care of themselves on a daily basis. And the nurses, they are acting like their family member. So they have to they feed them, they bathe them, they wash them. And some very elderly patients, you have to take care of the bathroom social issues. You have to take care of that and everything. So the nurses actually working very hard. I think they have a 4 hours shift for them. So even 4 hours, I think, is too much for them.
Yeah,
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 that's
that must be really difficult for you and for the families because yeah, I mean, I know very well that the families usually go in and help take care of. My brother-in-law. He had brain cancer, and when he was in the hospital during that time, we were all there with him, taking care of him and stuff like that. And it was uh, uh, um, I'm not necessarily sure if it was required, but that's what the family wants to do, right? So it must have been a
yes,
really
yes,
difficult time. So,
yeah.
when you were talking about these patients coming in and the risk to your kind of you and your colleagues, I mean, it must have been
Could you hold
kind of.
a second? Let me close the window because there's too much noise
Oh,
outside.
sure, sure, sure. Yeah.
Yeah, go.
Yeah, yeah. So what I was saying was, it must have been. I mean, like I said, we're all human. It must have been pretty scary, though, right? I mean, for one, when you were called out there, and two, when you're working in this environment. I mean, there must have been some, sense of fear, right? I guess when you're so busy that
Exactly.
that takes over, but I'm guessing you were.
Yeah, yeah.
Yeah.
I'm very the first 2 weeks, I would say the first 2 weeks is very hard because this is a brand new. No, actually, it's not brand new. It's a unfinished hospital we are sitting in. So when we are come here, we have a unfinished hospital. It's actually a construction field. It's not finished, and it's just an empty building. So we
Right.
spend a week to put in every equipment, all the pipe work, electricity, water, and all the patient beds, and all the video connection, the surveillance camera, video connection between the red zone and the green zone, and the computer and the doctor's living room. So so for the night duty doctors to sleep in. So everything we put in together in 1 week. So that week is very busy, and especially when you first taking in patient, and you're not sure if your preparation is proper, is good enough to prevent the doctors from being infected. And
Right.
so a lot of worries. And but after the first week, and there's a special team. They do the inspection on every department, every floors. They will check how does your door open. So how many buffer room do you have? So we call it buffer room. Before you get into the red zone, you have several buffer room to separate your and up before and also when you get out of the red zone into entering the red zone, the green zone, you also have different buffer room. So the special team, they will come and do the inspect, do the analysis. So they will tell you if you have something installed not right. They will tell you this is not right. So you have to do the change the route or change the how the door opens and everything.
Right. Yeah.
And after get used to it and everything is being correctly arranged, then that was the time we feel very relaxed.
Yeah, yeah. So
Yes.
if I'm understanding you right, not only did you have to be a doctor after this hospital opened, even before you were involved in the preparation of actually assembling things there.
Yes. Yes. It's
Wow.
because what the time we were first arrived here, it's a mess. It's a chaos. And I believe I remember it was I think it was around 10,000 medical personnel came to this town in 1 or 2 weeks. 10,000. So they all coming with the cargo plane, with the military transporter plane, huge plane with the materials. So the plane comes with the doctors and nurses and the materials, and give you they will deploy each team in a different hospital. Some hospital is already there. It's an old hospital that has been evacuated for the old patient. You just get there, everything is there. But some hospital is brand new, or some even it's not finished yet. You have to
Yeah.
deal with it by yourself. And the government, they will provide the supplies. So the huge trucks coming every day, huge trucks with all the equipments and supplies, and you got people working. We're working like 14, 16 hours a day to
Oh,
prepare
so
all the
those were your
equipment.
long days. Yeah, those were your long days. So I
But,
mean,
but, but
yeah,
go ahead.
the hospital was built incredibly fast. So were there inevitably some things like after you started operating, after you started getting in there, that there were little things that were still needed fixing, or little things that were like, oh, that wasn't, were there little things that came up, or more or less once you opened, everything worked perfectly?
No, no, of course not perfectly. You got the first 1 or 2 weeks. It's the hardest time because once you get into operating, you realize there's small things, but big things, the important things are right because you have already. We before we came here, we had training. So what kind of department, what kind of room you need, and what kind of passage you have to design, and what kind of ventilation for the air come in, which way the air come in, which way the air come out. So that those aspect is fine, but small details, it's like where the doctors eat. So how about the seals? So how do you seal the ceilings? Because you don't want air coming in from the red zone through this through the how do you say that? So so
The vent
you will,
store.
yeah, so constantly you will find small things that is potentially hazardous. So then that's the 2 weeks. You will constantly find something it's not convenient in hospital. But we have a very efficient, how do you say, backup team or supporting
Right.
team. Technicians, engineers, and the labor workers, they will come in and help you to build things and to modify things. Yeah.
Right, right, right. So, I mean, I would imagine after this experience, I mean, there's no experience like this ever before. I mean, you had, back in, during the, I believe it was the H1N1, 2008, 2009. I was
Yeah.
actually quarantined. I was coming over on the boat from Hong Kong to Shenzhen, and somebody
Uh-huh.
on our boat, on the boat from the airport to Sheko, had a fever, and I think they were from South America. And so we all got quarantined for 2 nights when they were checking everybody out. And actually, it was a pretty good overall process. The communication process could have probably been a little bit better, but I would imagine each time it gets better and better. And what you guys went through, can you imagine how much more prepared you'll be if hopefully there's not going to be a second wave, but if there is a second wave, or if there is a problem in the future, I would imagine China is going to be so much more prepared now with all of this experience.
Yeah, yeah. I guess, there's going to be some like I would say turbulence, not second wave, some kind of turbulence from outside of China, because now you see what happened in Europe, what happened in the United States. They are just getting started. So it's going to be when people get in from outside of China, constantly there's going to be a few cases, but I don't think there's going to be a big wave, a big second wave, or next season, second big wave in next season or next year. I don't think so, because now that the government have a huge lesson, after this, they get all the personnel well trained, fully alarmed, and they get all the population well educated, well informed from the
That's
TV.
The thing too. Yeah. I mean, the awareness from society now. Yeah.
Yes, and you got all the material supplies prepared, and they got huge warehouse in every city. Yeah, with several huge warehouse to stock all the medical supplies. They call it strategic warehouse. Yeah.
Yeah, that makes me wonder, because I know in at one point there was a lot of concern and worry about the supplies in Wuhan, whether the supplies were enough. Did you ever get in a situation where you didn't have enough stuff, or you never really got to that point? It was just getting really close.
We almost didn't. But the first batch. So we were the second batch. The first batch came 3 weeks before we came. So that was the hardest time. When they came in only like 1,000 or something, 1,000, 2,000 medical staff came here 3 weeks before we came. So that was the hardest time, because the patient was so much, and the personnel is not enough, and the equipment supplies is not enough. So people have to they have to wear or use not enough equipment, but only for, I think, 2 weeks maximum. That's the time they are very insured. They are very, very lack of all the personal protective equipment. That's only 2 weeks. But luckily, even during that time, we have very few medical staff infection.
Good.
So all the medical staff infection number you heard from the newspaper, that's from even before the first batch medical staff came. That's before that. So that was in January, the second part of December and the first part of January, that 1 month. And when people are not aware this is an outbreak, that time, that was the most medical staff infected time.
Yeah.
Yes.
So that speaking of this equipment, I just want to find out a little bit more about that. So obviously you've got these hair nets, you've got the N95 masks. What are the suits like that you're wearing? What are those? Is it multiple layers, or how does that work?
So normally when you get into the red zone, you have to wear 3 layers plus. I mean, the doctors and nurses, they are saying we wear 3 layers. The first layer, and most inside layer, is the scrubs. So that's the surgeons wearing. So you see the surgeons in the streets, sometimes they wear scrubs. It's like it's only a clothes, right? So that's the most inside layer that wears on top of your own clothes. That's the first. And the second one is the most important one. That's the one you see the people with with the hood cover the head, with the shoe cover that was connected to the suit itself. It's a one piece that contains all sealed suit. It's like a jumpsuit. It's like a jumpsuit. Yeah. Okay. Contains the shoe cover and the hood. And the outside layer, the third layer, is kind of like a surgeon coat. It's like a surgeon coat. Okay. So that's the 3 layer, and you wear 2 masks. The first, most inside, is this N95, and outside you will wear a surgical mask, and you wear a goggle but the goggle is to prevent the airs get inside your eye area, and outside the goggle you wear a face shield. That's for the to prevent the spew. Sometimes the patient when they coughing and they vomiting, so you prevent the spew of the and you wear two hats, and also a outside shoe cover and 3 layers of gloves. 3 layers of gloves.
Wow.
It's very hard, especially when you're when you are wearing 3 layers of gloves and you are doing the deep venous puncture. So you want your needle when it went through here, right, to find the deep venous to do the puncture. And when you're wearing 3 layers of gloves, it's very hard for you to feel the venous. It's very hard for you to find it. So it's normally if you're wearing 1 layer of gloves, you can find it very easily to find the deep venous, and you put your needle in, right? But when you wearing 3 layers of gloves, it's very hard. So sometimes it takes like half an hour, or sometimes normally you take 2 minutes or 5 minutes to find this. But sometimes in this, sometimes you take 15, 20 minutes. Yes.
Wow. And so it must be really hot too. I mean, you're sweating in this? Or?
Oh, yeah. It's good you mentioned that, because what we have in China, it's winter time. Starts from January to now. It's winter time. It's okay. So even if when we are wearing 3 layers of protection suits, it's okay. So you don't sweat a lot. But lately, for the past week, we were sweating a lot. Every time when we get out, our scrubs are total wet. All from the sweat. But you know what I'm imagining for in Europe and United States, what's happening there? And this is almost like spring, and some places are getting very hot, and it's going to be a big problem for the nurses and doctors, especially if they're working for long hours. It's going to be dehydrated because you're sweating too much. You can't drink and you can't use bathroom. Sometimes people get dehydrated. That's kind of some question that's been concerning me of the situation in the West.
Right. Yeah, that's a good point that I didn't think of. And does it take I would imagine it takes a long time to get all of this stuff on also, right?
So if you're fast enough, it take 20 minutes or half an hour to get well dressed and checked. So normally 2 person go in. You don't go in 1 person. You will normally 2 person go in and 2 person go out. So that way you can check each other equipment, check your suit if it's if there are anything wrong with if you are wearing it properly, they will check. So you will check each other. So, and when you're getting out, I mean, getting is very easy. You just get dressed, 3 layers of protection. Getting out is very hard because you don't want anything get contaminated. You don't want to bring anything from the red zone to the green zone, because that's gonna hurt the whole office, the whole department. So when you are getting out from the room, you get through 3 buffer room, and you're using so many sanitizer and so many spray, and so very complicated steps, very complicated procedure. So you do which procedure in which time, it's strictly according to the procedure. So if you miss with 1 or 2 steps, you will most probably bring some of the contaminated stuff into the green zone. Then it's a very hazardous situation. Yes.
Yeah, I would imagine so. And excuse me if this is a personal question, but I'm just thinking through the process, what it's like if you have to 20 minutes to get it off, 20 minutes to get it on. What about like bathroom breaks? Like how do you, I mean, that must be really, you just have to.
At the very beginning, the government, they're giving us diapers. So we're some people are wearing diapers. But especially when the second batch arrives, we have enough personnel. So our working shift in the red zone is not enough. So you get 4 hours. So for the young people, 4 hours is not going to be a problem. So we stopped using the diaper. We stopped. At the very beginning, we are worried about this situation. So everybody's wearing diapers. But after that, people are getting used to it. So they are not wearing diapers. it's gonna be
Yeah.
fine.
Okay. All right. Yeah, that must have been quite a situation. Now, I noticed when you guys are wearing the goggles, it's really kind of leaving marks, and there's some people where you can even see kind of the skin completely worn off.
Yes.
Are there any, so I would imagine this is a problem that people are going to face in other countries. Is there anything, any cream you're using, or you just kind of get used to it? Your skin toughens up. Like, how do you handle that? Do you have any advice for anybody who's
Yeah.
about to go through this?
I do have some advice. So personally, for this pressure you have from the goggles, right, and the pressure you have from the N95 masks. So here, especially the very vulnerable places here, because you have a N95, and the N95 masks here is very tough, very hard, right? So you press it very hard, and plus on top of it, you will press the goggle to seal this area, right? You don't want air comes in. When you're sealing it, you will press it very hard, right? So that may be hurting your skin, especially when you're working like long hours or for 1 month, 2 months. And what we do is that we put a bandage underneath this here. We put a bandage in advance,
Yeah.
right? And try not to use this metal. So you see here, this is a metal, right? This is a
Right.
metal. And there's so many different types of N95 masks. Some they are gradually they are changing, they're modifying the product. So now we're not using this metal thing. We're using this plastic. We have a plastic and sponges. We have a sponges underneath this, so that kind of reduces the pressure.
Okay.
And when you're pressing the goggles, and some goggles, their edge are very sharp, and when if it's too sharp, you can put some the bandages around them, so that's
Okay.
gonna reduce the pressure also.
Oh, that's
And
great advice.
another tip is that when you're breathing, so your breath come out, and when you make a lot of fog, blur
Yeah.
your goggle, and also blur the face shield when you're. So what do you do is that we use some kind of sanitizer, the wash lotion, the hand wash lotion. We use some lotion, and we use a cotton swab to spray the lotion on the goggles, the inside one, the inside goggles. Spray it very evenly, and you use a hair dryer. Use a
Oh, wow.
hair
Okay.
dryer to blow it and to dry it up, and after that you wear it. It won't blur. No matter how much you breathe into the goggles, it doesn't blur. So
Oh,
that way
wow.
you'll be
Yeah.
fine.
So yeah, I remember there's certain anti-fog things you can put on like your windows in your car or your side view mirrors. So it must be something like that effect where it stops it from fogging up, right? Oh, that's interesting.
Yeah,
Yeah.
exactly. We're getting that kind of stuff sprayed in, but you know what? Sometimes the spray doesn't even work. It doesn't even as good as the old way we use. The way we use is better than the spray. So sometimes we don't use the spray. We use
Oh,
the
that's
traditional one.
interesting. Yeah. These are valuable things for people to hear about. Yeah. So I want to back it up just a little bit here for a second in terms of kind of support, because I mean what you guys are doing, it's such a tough job. Well, first of all, actually, I want to say you mentioned a couple of times how the first couple of weeks were tough, and I would imagine for anybody who's about to see a lot of patients soon, it's going to be tough for them. And what happens after 2 weeks? It's just you kind of get used to it, you get in the momentum, you get desensitized to it, and you just kind of get in the zone. Like, how do you? Is it a matter of just getting used to it? How do you become not worried anymore, not scared anymore, not as like the first couple of weeks? You know what I mean?
Yeah, I understand what you mean. I think after during the first 2 weeks or even a short time after that, the most help we get mentally to calm us down is the information you get from the news, from the news, because the government, the news channel or the TV, they will put the numbers, the newly diagnosed, the confirmed cases, and the recovered cases, and all the new symptoms, and all the new discoveries, and all the new drug discoveries, and the process, and the vaccine process. They will put every information in the TV channel, in the newspaper, and and they will give you details that how the government is handling it, how the government is connecting resources and moving resources and doing which procedure to provide more efficiency the supplies and everything. So you watch this, it kind of it's a distraction. It's a
Okay.
distraction, right? It distracts you from worrying too much. And also, when you're reading all this, you kind of the government is taking care of you, so you get more trust. You get more, so you know somebody is behind you to give you to support you, and so kind of that relaxed me very much.
Yeah, yeah, I would imagine that would. And that makes me think, I really hope that when these other countries who are starting to fight this, they can put the politics aside for a moment so that their doctors can see the same thing.
Yeah, we
That
don't
it's,
have politics in a TV channel. So
yeah, that's
so
the,
a lot
that's
of
the
real
benefit here.
information.
Yeah, but
Yeah.
overseas, this is what they're faced with. They're faced with people looking for people to blame or to, it's about political parties fighting with each other and things like that. And I would imagine it creates an additional element that makes it a little bit more difficult for them. So I wonder if, as ordinary people, as ordinary citizens, if they can make up for that. And the reason I ask that is what I want to ask you now is, when you saw how much the people of China, the ordinary citizens, were cheering you on and were celebrating you and were saying "Jiao" and all of this stuff, did that help you also?
Oh, big time. That helps big time. It's very relaxing to watching this, and uh, I think the Chinese they don't we are not suspicious about we're not too skeptical about things. You see the people around you. So we're some of the medical team lives in a hotel. Like some live in a fancy hotel, some live in the regular hotel, and some live in some training center or school. So we're living in a training center, which provides also a hotel-like lodging for us. So when you're staying here, the training center, they provide all the personnel to take care of us, provide the food, right? And then they sometimes the cleaning. So people around us, they will constantly thank us, constantly appreciate the work we are doing. They will express their appreciation, and they will talk to us, and they will also express kind of what is the situation back in their home. So what's it like in their home? How many of their relatives are getting infected? What kind of problem they are facing? So we're kind of exchanging a lot of information, exchanging a lot of appreciation to each other.
Yeah.
That really brings us down, and every day the news is full of all kinds of appreciation from the country, from the government, from people in all parts of China. And that is really helping because the work you're doing are appreciated, and people are thanking you, and they are really care about you, and they're providing all the needs all your needs. So that's kind of very relaxing, and it calms me down.
Yeah, that's really good to hear, and I think that's really important for everybody else to hear, because if it's the politicians that can't put politics aside and they're going to do this, it's good to know that the people can pick up, where they're falling short, and the people of these countries can show their support to the doctors, and I hope people hear that and do that, because I would, obviously I'm very appreciative of your work, and to know that. It helps you guys, just feels good, and I'm glad that everybody rallied behind you. I know you've got an early shift at 6 a.m. There's so many other questions I would have loved to ask you, but I think that's
Don't worry about the shift. Don't worry
yeah.
about the shift. You can take as
Yeah.
much time you want. It's okay.
Yeah, no, that's okay. What I'll probably do is I'll think of some of the other questions, and maybe we can have a follow up. Or if you have any other ideas or tips, or I don't know if you have anything else right now that you could offer some words to medical staff overseas, anything from a technical point of view, emotional point of view, any words of support for them. If you have anything to say to the doctors overseas who are about to face this.
Not as much as a tip or any advice, but it's kind of a personal experience. I can share some of my personal experience that I have. But the situation in the West is now different because they're facing a different season, right? So what we're experienced is winter time, and now they're getting hotter, right, in the West. So I think my personal experience that first you have to, don't panic. That's the first thing. Don't panic. It doesn't help anything. And second, try to save energy. Try to save energy. So when you're save energy, especially when you're working in the red zone. And don't panic and save your energy when you're talking. Talk slowly and walk slowly, and try to communicate with a calm pace, right? So because in the first phase, when you're working in a red zone, you try to work, when you're walking, when you are doing procedures, when you are connecting samples, when you're doing the bedside endotracheal intubation, for the ventilator, for ventilator support, right? Or do the deep venous puncture. That takes a lot of energy. Once you finish that procedure, sometimes you get dehydrated, or sometimes people panic, and it will use up your energy, and that really harm you, because after the first 2-3 times you work in such condition, in such kind of such kind of mental condition, then it gives you a shadow. So you have a shadow in your heart. It gives you kind of you have a fear, right? So if you have a kind of it scares you away. I mean, if you have a tough first, second, or first 2 or 3 round, then for the future, in the next several days, you don't feel good. You don't feel confident. So it ruins the confidence, right? And the third part is that try to collect enough supplies as possible, as much supplies as possible, because it's critical for you to stay safe, to not infected, that you have enough supplies. And especially in the West country, I don't think they have, the most part of the country, currently they have enough, but in the long run, they probably don't have enough supplies. So that's the key point. If you don't have enough supplies, no matter how well you're trained, no matter how calm you are, you will still gonna be facing serious problem. That's my personal experience.
Yeah, and on to your middle point there, where you were talking about staying calm. I would imagine that you're dealing with some patients who are panicking also, right? Who have this and who are scared.
Big time,
And
big time. And
and yeah.
also I gotta point out that this testing thing, this testing kit that everybody's using. My personal experience that it doesn't work 100% precise. So for some patient, their testing find like 2 times, 3 times negative, but that doesn't mean they're not, COVID-19 patient. And their CT scan features perfectly right into the category of COVID-19. So they're very characteristic. Their CT scan very characteristic, but their testing is 2 times, 3 times, sometimes even 5 times negative. But you know what? Sometimes in a 6th time, it's positive, or sometimes even 8th time, it's positive. So this nucleic acid test probably doesn't work 100% precise. That's why you have to, in your department, you have to separate those suspicious cases and those confirmed cases. You have to separate them, and by separating them, you don't, because those patients who are confirmed by the nucleic acid test, they know they are confirmed. But those people who are diagnosed with the CT scan feature, they will probably worry that, okay, I'm not test positive. Why you put me mixed with these test positive patients in the same floor, same department? So that kind of, you need a lot of precautions to a lot of patience to discuss it and separate them.
Well, that sounds. There's a couple things that come to mind. That sounds exactly like what my sister-in-law was saying, who's working in one of the provinces. She says that she thinks a lot of the suspected cases are actual cases, but it seems like you
Yeah,
guys were very careful about this, where you knew the limitations of this test on this new virus, and so it sounds like you were doing, like you said, 8 tests, 9 tests to just make sure that these guys didn't fall through the cracks.
yeah. Sometimes we do it some even a dozen times of the
Wow.
nucleic acid test. So what we do is that if a person came in with a test negative, but a very characteristic CT scan feature, so we'll put them in a different section in a department. So we'll observe them and we'll keep testing them, keep do the nucleic acid testing, doing their nasal pharyngeal swab, right? We'll send them every 48 hours. So we're going to send the sample every 40 hours. Sometimes even 12 times, 14 times. But normally, so if 7, 8 times passed, the person's condition is recovering. The CT scan, the feature is getting better and better. So we're gonna discharge them after 14 days without any symptoms, and the CT scan 2, 3 times of recovering all the lesions on the lungs. So we're gonna discharge them,
Right,
and the
right,
confirm,
right.
in the other section. That's another story.
Yeah, yeah. I want to ask one question about that, because I've seen some reports from Hong Kong where they were saying that even after people have recovered, they still see kind of the damage that was done by it, whether it's permanent or not, I'm not sure, in the lungs, and some people still have a shortness of breath. Even after people are recovered, are there some, parts of their system that still need some time to recover after that, or they're going to have some longer term effects, or you're not really seeing that at this point, and it's just too early to say?
Yeah, yeah. So I think based on the experience from the SARS that's happened 17 years ago, um, actually only very few cases they will develop a sclerosis.
Oh,
Sclerosis
yeah, yeah.
for your lungs. It's like the scars, the tiny scars in your
That's
lungs,
it.
right?
Yeah, yeah, yeah. That's it. Yeah.
Yeah. So, but very rare cases, and even if you have that, it's gonna recover slowly. It's gonna recover slowly, but the case is extremely is rare. Yeah, for the most cases, especially for the young people, it doesn't leave anything. Doesn't leave anything.
Okay, that's
Yeah.
good. That's good. Well, I think I'm going to wrap it up here. We've spent an hour on this call. I really, really appreciate your time, and I just want to say again, thank you for everything you guys do. There's no word to describe it. There's just this deep a sense of thanks that I want to express to you. I've had a feeling like this before. During, it's a completely different situation. It wasn't a medical incident, but during 9/11 in North America, in USA. After that happened, the firefighters and the police and the construction workers and the volunteers who were going to clean up and with the rescue efforts, putting themselves at risk, breathing in that toxic dust. I had the same kind of feeling, just thanking them for putting themselves out there to, for the sake of other people. And again, there's not a word I can use to describe it, but I just thank you so much, and please express it to your colleagues also. I mean, especially, I know you're a guy who sees the internet outside. You follow my YouTube channel, and and I can imagine how sometimes, with so much support in China, when you look outside and you see the storm of accusations and back and forth, that it can be a little bit depressing sometimes. But I want you to know that the ordinary person, the ordinary foreigner, the ordinary person overseas, they appreciate what you do too, no matter what their political stances are, no matter how they feel about the governments. You guys are doctors. There are doctors overseas who are going to be facing the same thing, and you deserve all of the thanks that you get from everybody. So thank you.
Oh, you're welcome. Thank you very much for having me. And then, it's always a nice thing to do, to express, to tell the foreigners, or to tell the rest of the
Me
world,
too.
that what we actually are doing this. So it's kind of, thank you for providing this opportunity.
Yeah, my pleasure. It's definitely honest. So yeah, thank you so much. Okay, so we'll wrap it up there. Thank you so much, and we'll connect again soon.
Okay, thank you.
Take care.
See you next time.
See ya.